Today we are looking at diabetic foot ulcers. Diabetic ulcers are a serious complication caused by a combination of poor circulation, susceptibility to infection, and nerve damage from high blood sugar. When there is limited blood flow to the wound area, the body struggles to heal its skin wounds. So these wounds develop into diabetic ulcers. Diabetic ulcers are more prevalent among diabetics elderly. It is commonly estimated that a quarter of the people with diabetes will develop a foot ulcer at some stage. Unfortunately, a quarter of those with ulcers might end up with amputation. Diabetic ulcers are long-standing problems. Foot ulcers are a serious complication of diabetes mellitus that are associated with adverse sequelae and high cost. In addition, such foot ulcers have a significant impact on quality of life. For example, the loss of mobility associated with foot ulcers affect patients' ability to perform simple everyday tasks and to participate in leisure activities. Having an unhealing foot ulcer could lead to depression and poor quality of life. Several studies have shown that patients with diabetes and foot ulcer are more depressed and had poorer quality of life than those without diabetes complication. According to David et al. 2017, diabetes mellitus is a serious lifelong condition that is the sixth leading cause of death in North America. Up to 25% of patients with diabetes mellitus will develop diabetes foot ulcer. Foot ulcer patients have an increased risk of amputation and increased mortality rate. Early recognition of the high risk of foot ulcers and timely treatment will save lives and improve patients' lives. Foot ulceration is the most common lower extremity complications in patients with diabetes mellitus. A diabetic foot ulcer is a slow-healing open wound or sore that can develop on the skin of the people with diabetes. A diabetic foot ulcer is an open sore that occurs in approximately 15% of people with diabetes, and most of those develop infection and complications. Most of these foot ulcers are on the leg. Complications of diabetes that affect the lower extremities are common, complex, and costly. Foot ulceration is the most frequently recognized complication. In a study done in northwestern area of United Kingdom, showed that the prevalence of active foot ulcers identified as screening among persons with diabetes was 1.7%, and that the annual incident rate was 2.2%. In 2015, the annual incident rates of people having foot ulcers in specific populations are as follows: 6.0% among Medicare beneficiaries with diabetes, 5% among U.S. veterans with diabetes, 6.3% in global population of persons with diabetes. According to International Diabetes Foundation in 2015, the prevalence data is estimated annually to develop foot ulcers is 9.1 million to 26.1 million globally. Lifetime incidence of foot ulcers has been estimated to be about 15 to 25% among people with diabetes. The risk of death at 5 years for a patient with diabetes foot ulcer is 2.5 times higher as the risk for a patient who does not have foot ulcer. More than half of diabetic foot ulcer become infected. Approximately 20% of moderate or severe diabetic foot infection lead to some level of amputation. Mortality after diabetes-related amputation exceeds 70% at 5 years for all patients with diabetes and 74% at 2 years for those receiving renal replacement. The risk of death at 10 years for a patient with diabetes who had a foot ulcer is twice as high as the risk for a patient who has not had a foot ulcer. An assessment conducted between 2007 and 2013 showed that diabetic foot ulcer and associated infection constitute a powerful risk factor for emergency department visits and hospital admission. The rate exceeds the rates for congestive heart failure, renal disease, depression, and most forms of cancer. The direct cost of treating diabetic foot complication exceeds the treatment cost for many common cancers. In the United States of America, a total of $176 million is spent annually on direct costs for diabetes care. As much as 1/3 of this expenditure is linked to lower extremity related ulcers. Diabetic foot ulcer are commonly caused by repetitive stress over an area that is subject to high vertical or shear stress in patients with peripheral neuropathy. When a patient has diabetic mellitus, he or she develops a motor neuropathy, leading to foot deformity and biomechanical abnormalities. The person will also develop sensory neuropathy, which is loss of protective sensation. And the third neuropathy is autoimmune neuropathy. Addressed foot ulcers are a significant complication of diabetes mellitus and often precedes lower extremity amputation. The most frequent underlying etiologies are neuropathy, trauma, deformity, high plantar pressure, peripheral artery disease, ulceration of the foot in diabetes. Is common and frequently lead to amputation of the leg. Mortality is high and heel ulcers often reoccur. Despite treatment, foot ulcer readily becomes chronic wound. Let's briefly look at how do we prevent foot ulcer. 1. Patient education is very key. 2. You must have good diabetics control. You must be able to adequately manage the blood sugar to be within the stipulated range. There must be ongoing professional foot care of between 1 to 3 months every quarter. Then, wearing proper fitting shoes. Early recognition of new lesions and self-management. So when you put this in use, you'll be able to protect your limbs. But most importantly, managing your sugar tightly so that the blood sugar level is within the approved range. And then undergoing a lifestyle change to be able to adapt to the needs of the hour. And finally, wearing appropriate foot care. I would like to hear your comments on this video below or your questions, and I will respond.